Imagine this: a dark room, a wooden table, and you lying on it. No anesthesia, no painkillers, just the surgeon's sharp knife and your pain. This was reality 200 years ago. People came in for surgery voluntarily, but everyone understood one thing: the chances of survival were about 50-50. It was a lottery with death. The operating room smelled of blood, pus, and alcohol. Doctors didn't even wash their hands. No one knew about microbes. And the more blood there was on the surgeon's coat, the more experienced he was considered. Dirty aprons were a mark of skill. Inside the operating room, there was a crowd of spectators. Yes, surgery was a show. People came to watch the surgeon compete against time, because the main goal wasn't precision, the main goal was speed. The pain was unbearable. Patients were given only a piece of leather or a belt to bite on. Sometimes they were given rum to drink, but it hardly helped. The surgeon raises a huge knife, looking like a butcher's. The instruments weren't sterilized, just wiped with a rag. And the amputation begins. One cut, skin. Second, muscle. Third, the saw bites into the bone. The patient screams and thrashes. Assistants hold him down with all their strength, otherwise the surgeon might miss. Blood pours onto the floor. The surgeon is in a hurry. Every second means extra pain and extra risk of death. The best surgeons could perform an amputation in 2 to 3 minutes. Robert Liston was the record holder. He could cut off a leg in 30 seconds. But his most legendary operation ended with 300% mortality. He cut off his assistant's fingers, accidentally killed a spectator from shock, and the patient died from infection. At that time, this was nothing out of the ordinary. Infections were the main killer. No one understood where they came from. In hospitals, people infected each other just by touching a door. Sometimes patients died from hospital fever in a couple of days. Everything changed after the discovery of microbes and antiseptics. Doctors started washing their hands and instruments, and mortality rates dropped sharply. Then ether anesthesia appeared. For the first time in the history of medicine, the pain went away. And surgery transformed from a bloody lottery into real science. Today, operations save millions of lives, but once they were pure torture. And people survived thanks to only one thing: their will to live.